RICAT, promoted by the Ghana Group, is a multi-center phase 2 single-arm study investigating re-challenge with anti-EGFR in metastatic colorectal cancer patients. The idea of the study was born from the observation by retrospective analysis of Santini that examined patients who had a clinical benefit following a line of cetuximab plus irinotecan-based therapy and then a progression of disease could benefit from a treatment with the same or another cetuximab plus irinotecan-based therapy showing encouraging results. The main purpose of our study was prospectively evaluate the efficacy of this re-challenge strategy, analyzing the activity of third-line cetuximab plus irinotecan in metastatic colorectal cancer patients who clearly derive benefit and then become resistant to first-line cetuximab plus irinotecan. It is important to underline the strict inclusion criteria of our study. All the patient must have received a first-line irinotecan-based, like FOLFIRI or FOLFOXIRI, and cetuximab-containing therapy, producing at least a partial response, and also with a first-line progression-free survival of at least 6 months, to clearly demonstrate initial sensitivity. Moreover, the disease progression to first-line therapy must have been within 4 weeks from the last administration of cetuximab. RAS and BRAF wild-type status of primary colorectal cancer and/or related metastasis was also important. The primary endpoint was the overall response rate, but also progression-free survival, overall toxicity rates was considered. Based on the study design, 27 patients had to be enrolled, and this strategy would have been considered promising if at least 4 responses were observed. Moreover, liquid biopsies were collected in order to identify described mechanism of secondary resistance, including KRAS, NRAS, BRAF, and PI3K. The study enrolled 28 patients, and the recruitment is closed. 26 patients were now evaluated for response. Talking about results, the primary endpoint was met. In fact, 6 partial responses were reported, with a response rate of 23%. 8 stable disease and 9 radiological progression disease were observed. The disease control rate was 54%. A challenge with cetuximab plus irinotecan is active in some patients with RAS and BRAF wild-type metastatic colorectal cancer, initially sensitive and resistant to first-line irinotecan-based chemotherapy plus cetuximab. Analysis on circulating free DNA collected at the study entry are ongoing in order to verify whether the detection of markers of acquired resistance to cetuximab may help to identify patients more likely to benefit or not from this strategy.